Well, it's just nice feeling weather in the morning.
Yeah, I'm doing wonderful. You know, when I got up today, it was a little muggy, and I said, well, I think it's going to be a hot day, and I think I was right.
You should have gotten up an hour around 5:30. It felt really, really.
Yeah, that would have been a nice time to be out. Well, I was up at that time, but I just wasn't out the house at that time.
Okay, okay. All right.
Yes, I was still up.
I'm lucky today.
Yeah, a little muggy, but you know, we're still blessed to be here.
Yes, indeed.
You know, within our good health and doing well. So you know, today, last few times we talked about some vitamins, minerals. We've talked about the Mediterranean diet. So I think I'm going to continue along that vein today, because there's so many misconceptions about vitamins and minerals and what good are they, what are you using them for, and so forth. So I thought it'd be a good idea just to continue along there and give our listening audience a better understanding of that.
Okay, I don't mean to interrupt you, but there may be somebody new listening today. Tell them about the web.
Okay, well, for those of you who may be local, this is being broadcast from Ahoskie, North Carolina, 9:70 a.m., but I'm also coming to you from Down East Nursing Home, where I break from seeing patients. I come on here and do our program. It's always going to be about something preventive health and something that hopefully you can use right now. Now, for those of you who are computer savvy, or don't even have to be computer savvy, but you want to get on the internet and you want to watch us live, you can go to my website, AskDrFerguson.com. Right in the center of the page, you'll see live radio broadcasts. If you click on that, that will take you to my YouTube site, at which time there's a little house in the top right-hand corner. You click on that, and then click on Feed, and then you'll be able to catch the program live. There's about a 30-second delay, so if you choose to catch us live, you might want to turn your radio down because it's going to be a little disjointed hearing what I'm saying and seeing it not happening at the same time. So for those of you who want to catch the YouTube, we've been getting a bigger and bigger audience on YouTube. And again, YouTube is the World Wide Web, so people from across the world are able to catch this program, not just those in the local area. So we do encourage all of you to do that. And for those of you who missed a part of this or want to get more information, these recordings do stay on my YouTube site, so you can go by and see them at a later time. Just go to YouTube. You can go to youtube.com/user/AskDrFerguson. That'll take you to the website. And then all of these YouTubes that I've done in the past are archived. I think there's probably approaching 108, 170 of them or something like that.
Wow.
So quite a few of them out there. Lots of different topics. I have topics like Alzheimer's disease, substance abuse, hormone balancing, and I do what's called a passion cam, where I just put my camera on my dashboard and I talk while I'm driving about some topic that I'm passionate about. And that could be anything, but it's always going to be something positive. So for those of you who in our listening audience and want to check out some of these things on the computer, by all means, you should do that.
Wonders of technology.
Yeah, wonders of technology, I tell you. And the other thing, you know, for those of you who want to see us personally, you can always make an appointment to see us in our office at 252-332-6484. We'll be happy to see new patients. We see new patients all the time. We really enjoy working with Alzheimer's disease, geriatrics, and the whole family too, but I like those especially, as well as natural hormone therapy. Great success in that category. So those areas are some interest to you. Come by and see us. Call and make an appointment. We're happy to see you. So back to our vitamins and minerals. We've been talking about that the last few weeks, and vitamins and minerals are kind of that category where many times you get what you pay for. Sometimes you hear people make that statement, it might not be true. Vitamins, for the most part, vitamins and minerals, the way in which they're bound, say the coating you put on, the wrapper you put on them, that makes a huge difference on how easily you dissolve that particular vitamin, how easily you dissolve that particular product. As well as you have synthetic and you have natural products that can go into some. Like for vitamin E, you could have the synthetic vitamin E or you could have the natural vitamin E. Well, the synthetic vitamin E is much less potent than the natural vitamin E. So the natural vitamin E is about 75% more potent than the synthetic. But on the shelf, you'll see vitamin E 400 milligrams. They'll be sitting next to each other. One costs $18 and one costs $4. And you look at them and say, well, they're both the same. Well, I'm going to get the one that costs $4. And so those are settings where you just may not be getting what you think you're getting. And so it's important to educate yourself on vitamins and minerals, begin to read the labels and gather some understanding, you know, ask the pharmacist, read the label, go look it up on the internet, and you'll see there are some subtle differences many times, but in medicine those subtle differences can be huge. So, like for example, garlic. There's tons of garlic when you get to the store. You'll see tons of garlic on the shelf, different makers, different brands, and they're going to have different amounts of allium. Allium is the active ingredient in garlic, so that's actually what you want is the allium.
Oh, glad you mentioned that.
And so when you go look at that garlic, and there's multiple ones, one has this amount, one has this amount, flip the label over and see how much allium is in it. Now, I don't usually recommend particular brands, but the brand I have found to be the best for that one, and there may be others, is Spring Valley gel caps. And the reason for that is because the gel caps are you're not going to taste them if you don't swallow them on the first try, and because they're one of the odorless ones, so people are not going to know you're taking garlic once it's in your system. And each of those has, I think, 1,200 milligrams of allium, and I usually recommend 3,000 to 5,000 milligrams of allium per day to help boost the immune system. It also helps a little with blood pressure.
Okay.
So that was that. Now that's not in the vitamin mineral category. That's in the herbal category. Just kind of a little side note as we're talking about how do you evaluate, how do you pick the vitamins and minerals. Many times your health food stores or your multi-level marketing companies are going to have your better vitamins and minerals, and they're going to have the ones that they're just going to have better ingredients. But again, you're going to pay for those better ingredients. So vitamins could range from $5 to $65. And you say, well, what's the difference? Well, there could be a huge difference, or there could be little difference at all. So you have to become a savvy consumer and begin to read your labels and understand what you're reading, ask questions, begin to build upon your fund of knowledge so that you can get the right things you want. So just as a summary again, we talked about vitamins, minerals the last couple of weeks. Vitamins are compounds that are organic compounds. They're necessary for normal growth and maintaining your body. They're regulators, but they do not provide you any energy. They help in the process of energy, but vitamins don't actually provide energy themselves. They work as catalysts, they work as enzymes in your body to help a process, to help you maintain your body and to help transform food into energy. But they don't actually provide any energy themselves. And because your body doesn't make them, we call them essential. When your body doesn't make them, we usually call those essential nutrients. And essential usually suggests that it's something you have to take into your body, something your body can't do on its own. That's generally when we use the word essential in medicine. That's usually what we're saying. You gotta have it, and then the body doesn't make it. Okay, that's kind of the way that terminology could vary in its usage, but that's generally the way we mean when using it in medicine. And when we talk about vitamins, they're often referred to as micronutrients. Again, I just told you they weren't a nutrient, but we refer to them as micronutrients, and that's because they're small. It only takes a small amount to get a big job done. And they're essential. Your body cannot make them. Your body can't go without them. So you have to be able to take them in from the outside. And where do you get them from? You get them from your plants and your animals. Most of your plants and fruits. Animals, they eat the grass, they eat the fruits and the stuff and the vegetables. So what minerals and vitamins they take into their body from that source, they do get that. But for the most part, your bigger source is going to come from your fruits and vegetables. Okay? Yeah. People always ask as a little quick quiz here. So is a watermelon a fruit or a vegetable?
I would say it's fruit.
A fruit. And that's what most people say, but it's a vegetable.
Oh, really?
Like squash, zucchini. Think about how it grows. It's on the vine, just like those. So it's actually a vegetable, but most people guess like you just did as a fruit. Just a little side note. Back to the vitamin mineral. So when you talk about vitamins, again, I'm going to do a quick summary, and then I'm going to try to get into some more specifics of what's in vitamins. The vitamins, we got the B and the C's. Those are your water-soluble vitamins. And the water-soluble, you dissolve in water. And then you have your fat-soluble vitamins. That's your A, your D, your E, and your K. Now, there's other vitamins, and those are the big ones we talk about. And the fat-soluble vitamins, you can become toxic on. The water-soluble vitamins, not usually, because you're going to put it out in your urine. So if you take too much of vitamin K, vitamin E, vitamin D, that can build up into your fat tissue, and it can store in your fat tissue, and you could become toxic by taking too much. As opposed to the vitamin C and the B's, you're usually not going to take too much of those because your body's going to put out in the urine. A lot of times you hear people talk about, oh, taking all those vitamins, it just gives you expensive urine. Well, your body's going to take what it needs and it's going to put the rest out. So you can't determine if your body needs 10 milligrams or 15 milligrams or 100 milligrams. So you just have to go based on what science, and there's not a lot of times there's no science involved in the natural stuff, but you just have to go based on some reasonable data, some reasonable guess or estimate, or it might be some good research from time to time.
So the body itself can regulate that.
Your body doesn't know how much. It does regulate it.
Oh, okay.
But it doesn't know how much to tell you to put in it. How much vitamin C do you need? Well, they know that we need 65 milligrams of vitamin C a day to prevent scurvy. But, most people probably never even heard of scurvy. And I recommend 2,000 milligrams of vitamin C a day. And if you're sick, bumping it up to 5,000 to 10,000 milligrams a day. They say Linus Pauling, who developed the alpha helix, which is part of the DNA structure, they say he took 5,000 to 10,000 a year for most of his life, but they say he was never sick and he died in his 90s. Now, I don't know that to be accurate because I had never done any research on Linus Pauling, but that's the rumor.
Yeah.
And so that's a little about the vitamins. And then we also been talking about minerals. And minerals are, as opposed to organic, which I told you, minerals are inorganic. Or non-organic, I should say, not inorganic, but non-organic, and that means they help your body, but they're never destroyed. They keep their same form, they keep their same structure. They don't change at all. So whatever minerals that God put here on the earth from the very beginning are still the minerals we have here now. No change in the form, and they hook up with the vitamins, and they make a couple sometimes, and they help our body through many different processes. Some of your common minerals: phosphorus, sodium, chloride, potassium, magnesium, sulfur. Many of you probably heard of those as minerals. And the minerals can also, those are macro minerals, those are they're bigger. You have micro minerals as well. But your body consists of about 4% of minerals. That's it. But that's a lot. Calcium is a mineral. So your bones are loaded with minerals because that's calcium. Your teeth, your hair, all of those have minerals in them. And your minerals are needed. So where do you get your minerals? Fruits and your vegetables, for the most part. So if you're not eating fruits and vegetables, you're probably going to be out of balance. So people used to say, well, if you eat healthy, you don't need vitamins and minerals. Well, I would disagree 100%. Because the soils over the years and years have been depleted of some of the nutrients and vitamins that we need. I call them nutrients, again, they help in the process of getting your from food to energy in your body. They're not actually nutrients themselves. But over the years, your soils have been depleted many times, and so many times it's deficient in some of your vitamins and minerals. So if you don't take them in as supplements, then you may not get enough of that particular thing. Does that make good sense?
Yes, it does.
Okay. I want to let those watching by internet or on the phone, you can always listen on the radio. You can always reach us at 252-332-6484. A lot of times people have questions that they don't want to call in and ask. A lot of times they say, why don't you call and ask your question while we're on the air? I say, well, no, we're in our program. So anyway, ask your question to the radio station, call to the office, ask your question, and we'll try to talk about that on the show coming up. Then you can catch us live at youtube.com/user/Dr. Ferguson, or go to my website, askdrferguson.com, in which we have a lot of nutritional supplements that one can be helped with, and some links to some good sites. But there's a little, in the middle of that page is a link. You can click on it. That will take you right to the live radio program. Click on the little house in the top right-hand corner, which is it. And then click on feed. You'll be watching us live. So those of you who want to catch us live, that's how you do it. All right, back to the vitamins and minerals. We talked about they never disappear. They don't burn up. They're there forever. We talk about, I don't usually talk too many political things, but we talk about us releasing the prisoners and what deficit that might be. I would be a bit surprised, as over the years they fed them some type of mineral that was attached to something where we could track where they are. And then we could go and find them if they go back to the Taliban and get the whole group. I wouldn't be a bit surprised. Our technology is very significant in the U.S. and the media sometimes pushes it the wrong way, so to let our different secrets out and things. But I would think we have the capability. I know we attach compounds to minerals all the time. If you do an X-ray study, we attach an iodine to that, so that shows up on the X-ray study. So a lot of we're capable of attaching things to the minerals, and then the minerals get into your body, and then they get attached to different spots in the body, and then they hang out. Like a mineral that attaches to your bones. Your bones take 8 to 10 years to resolve. So if you look at your finger, in 8 to 10 years, that's going to be a new bone in your finger. But it does it really slow. Your bones are constantly eating away and building the entire time. And so we attach a compound like bisphosphonates, for example, that women use for osteoporosis. Again, I'm not supporting bisphosphonates. I think they're not good. But bisphosphonates, one of the common, are commonly used to help women with osteoporosis. Well, what do? That attaches to the bone. That's a compound that attaches to the bone. So what would stop our government from using a compound that attaches to the bone, where we could find where these guys are, and be able to take care of them?
Something to think about.
Yeah, something to think about. A little side note. So I would think that would be a much more probable thing than not. But back to our minerals. Little political side note. I don't usually go down that track, but we did today.
I was thinking we don't want the enemy to listen to this program. Get any ideas.
Yeah. That's the problem. We think everything should be in the open, and that's it shouldn't be. It really shouldn't. We're back talking about minerals. We talked about some specific ones last week. Vitamins and minerals. Again, vitamins are in or non-organic, meaning they never change forms, and then the vitamins are organic. They do change forms, so your body does utilize them. And organic usually refers to more living as opposed to not living. Non-organic usually refers to something not living. Like a rock, we refer to that as non-organic because it's not living. That's kind of the way we refer to the vitamins and minerals. So let's look at some specific amounts of vitamins and things that are recommended for different help different parts of your body. Now, we're going to go through a list of different things here that can be helpful, but understand you probably want to gain some knowledge about this and not just go out and try to buy all these things individually, because then you'll end up with 30 medicine bottles sitting on your table, and that may not be too good. So retina A, people have heard of that. That helps with your vision, helps with mucous membranes, helps with your bone and your tooth growth. It's suggested that one gets 5,000 international units of that a day, which sometimes might be referred to as 1 milligram. That would be the recommended daily allowance on a daily basis. Now understand what the recommended daily allowance means. For the most part, it doesn't mean a whole lot. But it is a basics of this is when they did some research in the distant past, their goal was to say, how much of this particular vitamin and mineral do we need not to get a specific disease that we already know about? Like for vitamin C, it was scurvy. So when people were crossing the sea, a lot of times slaves and those crossing the sea, a lot of times they got scurvy because they didn't get any vitamin C. And so we know that if you get 65 milligrams of vitamin C a day, then you won't get scurvy. But many times the amount that you really need is far more than that recommended daily allowance, because that was really kind of comes in at the minimum side.
Okay.
And the way they came up with those numbers was with a cohort of white males in their 20s. And so that doesn't describe the average population, average person in the population. And so how valid are those recommended daily allowances? So I suggest you use them as a guide, as a starting point, but not as the almighty by any means. Just as a rough, okay, I know I need at least this amount. That would be the way to use that information. B1, which is called thiamine. A lot of times a person is an alcoholic, they become deficient in thiamine. So a lot of times what we do initially when we start treating an alcoholic is we give them some thiamine, which is B1. It helps in energy metabolism, it helps in your nervous system function. And recommend 1.5 milligrams of that per day. Okay, riboflavin is another one, the B vitamin. So we're running through the Bs right now. That helps with energy. It helps maintain eye tissue. 1.7 milligrams a day would be the. Again, these are the recommended daily allowance amounts, which could vary greatly. It could be much higher than this. Many times is what I would recommend, and when I come across those that I use regularly, I'll tell you the amounts that I recommend as opposed to the recommended daily allowance. B3, that's niacin. A lot of people heard of niacin. Niacin can be helpful with your cholesterol, but it also can give you nights. It can give you like hot flashes, like you can break out with a sweat. It usually only lasts about 20 minutes, and that's one of the, I don't know if you want to call it side effects. That's one of the things that happens when you take niacin. That's why when you take it, you should get one of the anti-flush niacins. So if your doctor has you on that for your cholesterol, you're going to be taking a large amount, maybe up to 2 to 3 grams of that a day. The recommended daily allowance is 20 milligrams. But 20 milligrams is not going to do much for your cholesterol. But it is helpful in your energy metabolism, it's helpful in your skin, it's helpful with your nervous system, your digestive system. B5, okay, this is another one of your B vitamins that's not a common one that people are going to go off and look for, but they can find it many times in a B complex product. And B5 is key in helping maintain your carbohydrates, your fats, your proteins. It's involved in that system, helping you maintain a good balance between your other nutrients like that. The B6, B7, a lot of times you don't hear a lot about those. Folic acid is B9. That's very important, particularly when babies are in utero, because that helps in developing the nervous system. It helps in developing the reproductive system. It can be helpful in that. Necessary for the division of the cells. So when a person gets spina bifida, many times they feel like they were deficient in folic acid while they were involved in the belly, while they were still in utero. B12, a lot of people hear that, they think, oh, give me some B12, give me some energy. That helps in cell synthesis, it helps maintain the nervous system. I'm not sure what's in B12 that makes a person feel like they have more energy, but that is another common one that people will take to get more energy. The recommended daily allowance is 6 micrograms per day, not milligrams, micrograms, so very small amount. But when somebody's deficient in vitamin B12, a lot of times we'll put them on an injection of B12 or sometimes by mouth, and then we'll give them a much larger amount. Vitamin C, ascorbic acid, many people have heard of that one. It's called ascorbic acid. It helps in collagen formation, helps with amino acids, it helps with metabolism of your iron, it helps you absorb different foods, it helps you with being an antitoxin in your body. It's a great antioxidant. I talked about that in some programs in the past, since I'll do a brief detour on that. In your body, when the cells are functioning abnormally, you get what's called a free radical. A free radical is a cell that's lost one of its electrons. And the way I usually refer to it is take an orange and say it has 2 ears and now it's lost an ear. Now what things like vitamin C and other antioxidants do is when they come into the system, they bring that, and they help that cell become back whole again. So they help put that ear back on that orange. They help bring the electron balance back to that cell. That's what antioxidants do. And vitamin C is a very strong antioxidant. So if you have a good, strong foundation of antioxidants, you'll have less incidence of colds, less incidence of viruses, bacterial infections, and less incidence of cancer. Cancer takes 5 to 8.5 years before you can detect it in any short shape, form, or fashion. 5 to 8 years. Your cancer is growing a long time before you have any clue about it. And this brings us back to preventive health. This is why preventive health is so important. You've got to do preventive health. You don't want to wait until you got diabetes to try to start being preventive. You don't want to wait till you have hypertension to start saying, maybe I need to eat and exercise right. You don't want to wait till you're overweight to say, oh, I guess I should lose some of this. That's not preventive health. You want preventive health. It's so much easier to take care of a problem before it's a problem. And how do you do that? Well, we never know. You never know how great you're doing or how well you're doing unless you don't get that particular disease that the rest of the population gets. You talk about preventive health. You know, I frequently talk about Alzheimer's disease. Well, they did a large study at Columbia University out in New York, and they had over 2,000 people in it, and some ate the Mediterranean diet, kind of sometimey, and others ate it all the time. Those that ate the Mediterranean diet or ate like the Mediterranean diet all the time, they found they had a 40% decreased incidence of Alzheimer's disease. And that had that was a very scientifically significant study with a p-value of 0.07 for those of 0.07 for those of you in our audience that understand that factor. So very, very scientific, very, very specific. So what am I saying? I'm saying that by eating the Mediterranean diet and eating like that, you're getting things that you don't know that you're getting. You're getting a lot of antioxidants, you're getting vitamins and minerals, and you're getting some other cancer-fighting compounds that you couldn't sit here and dissect that broccoli and say exactly what you're getting. But you can know that based on studies like that, that they have some great preventive health associated with them. Does that make sense?
Yes, sir.
Yeah, so this is why preventive health is so important. You know, they did a study on, I think they call it the bluezone.com. I think if you go to bluezone.com on the internet, you may or may not get that now because I think some other people have grabbed hold of that name.
Oh.
But bluezone.com was a study amongst scientists throughout the world, and they studied the 5 oldest populations in the world. And what they found, one of those was in the U.S., was in between L.A. and San Francisco, out in California. And each of these populations was about 18,000 people. And what they found was there was a consistency throughout each of those 5 populations. Now, although they may not have called it the Mediterranean diet, all of them ate very similar to the Mediterranean diet. Other characteristics they had amongst all of them, they had a friendship network. Other characteristics, they all had some form of exercise. They might not be going to the gym like you think of, but they were active and busy and working throughout the day, up and down the steps, things like that. And the 4th common characteristic, I'm blanking on what was the 4th common. So they had an exercise program, they ate healthy, they had a friendship network. Oh, I didn't remember. I remember the 4 common characteristics. They never retired.
They continue to work.
They continue to work. And what does that mean? I'm not saying you need to continue to work the 9 to 5 that you're working now, but never retire has an implication of having a why for getting up every morning. So, you know, I'll sleep to 12, I don't have enough to do tomorrow. But having a why, a reason that you're getting up for each morning, something that you're going to do, something that you're looking forward to on that next day, that they found to be very, very important in these populations' longevity, having a why for getting up in the morning. And they many times had a very consistent system, whether it was Monday or Sunday, they were still getting up at the same time and going to bed at the same time.
So basically, just beyond what we call the retirement years, continue to stay active doing something.
Absolutely. It's something you want to do. Not just doing something, but something you want to do. They show that people that sit around and do nothing after they retire have a 3 to 5 year decrease in their life expectancy. 3 to 5 year decrease. Very significant. So don't just retire and go sit around and do nothing. I know we're coming near the end, so I'll try to do a little bit more before we end, but I always want to let people know they can reach me in my office at 252-332-6484. They can go by my website at askdrferguson.com. They can go by my YouTube at youtube.com/user/AskDrFerguson. And there's so many other places I have a presence on the internet. Those of you who know I'm into photography, I really enjoy that. Those of you who want to catch my photography site, you can go to photomedoc.com. And forget everything I just told you. If you go to the Google search window, and if you just type in Stephen Ferguson MD, Ask Dr. Ferguson, all of those will take you to multiple places where I have something on the internet already. And those of you who are listening to our program regularly, you know, give us a call, let us know what you like, what you don't like, how we can improve it. I'm always interested in improving things and making it better, making it more friendly, making it more useful for those of you. And those of you who missed the program today or catching it up, you can go to youtube.com/user/Dr. Ferguson, and you can catch the archive copy sitting there. So on that note, to you, Bishop, and to our entire listening audience, I say be blessed and have a wonderful day.
Take care, Dr. Ferguson.
All right, bye-bye. All right. Those of you who are still with us live, I'm going to say to you all, have a wonderful day as well, and come back next week from Wednesday from 9:30 to 10. Tell your friends about us, and join us, and share the site with others, and come join us live on the YouTube.